Well, the air quality index in the national capital, it is again choking its residents. The AQI hit alarming levels on Wednesday morning as a thick layer of smog engulfed the national capital and surrounding areas of Noida, Ghaziabad, Gurugram and Faridabad. The smog, combined with fog and mist, led to reduced visibility during the morning hours. And Delhi's air quality index was in the very poor category for the 15th day running, beginning October 30th, when it was recorded at 307. Now, the air quality index for Gurugram, Noida and Ghaziabad were in the poor category. Delhi's Anand Vihar, dubbed the pollution hotspot, remained one of the most impacted areas with an AQI of 399. Similar conditions were observed in Ashok Vihar, where the AQI stood at 370 and Jahangirpuri at 389. The IGI Airport stood at 368, ITO at 378, Mandir Marg 357, all in the very poor category. Stubble burning in Punjab and Haryana after harvesting and the paddy crop is often blamed for Delhi's rise in pollution. An EQI between 0 and 50 is considered good, 51 and 100 satisfactory, 101 to 200 is considered as moderate, 200 to 300 poor, 300 to 400 is very poor, which is where we're at across the national capital region. But there are also some health complications that come along with this air crisis that we're witnessing in the Delhi-NCR. Both short and long-term exposure to air pollution can lead to a wide range of diseases, including stroke, chronic obstructive pulmonary disease, trachea bronchus or lung cancer, aggravated asthma and lower respiratory infections, according to various health experts. Now, there is no need to panic at this point in time, but the situation could get worse in the coming days. There are also a series of precautions that experts have now suggested that people must follow and that can help them live a healthy life, like staying indoors, exercising inside rather than outside, not letting your children go out and rather play indoors. Pregnant women should avoid stepping completely out, keeping the windows and doors closed, using air purifiers at homes, maintaining proper ventilation inside your house, maintaining a balanced diet, antioxidants, you name it. There are so many things. And amid the ongoing smog season, a survey that was in fact done by local circles, 21,000 families in the Delhi-NCR have brought to light many shocking facts. Let's tell you about that as well. Number one, ladies and gentlemen, 81% of families in the Delhi-NCR have a member with pollution-related illnesses, ladies and gentlemen. 4 by 10 families have visited a doctor or a hospital for treatment in the last 20-25 days alone. Every second family is buying medicine for pollution-related illnesses. That's what a survey is telling us. And every third family in the Delhi National Capital Region bought cough syrup over the last 20 days, let alone 13 people in the Delhi-NCR that have bought inhalers or nebulizers as well. That's the situation in the Delhi National Capital Region. Dr. Anant Mohan, Professor in HOD, Department of Pulmonary Medicine and Sleep Disorders, AIIMS, joins us on the broadcast here. Very warm welcome to you, Dr. Mohan. Doctor, first and foremost, the survey tells us that at least 81% of people, families in the Delhi National Capital Region have a member with pollution-related illnesses. Are you witnessing the same trend in terms of patients in the Delhi-NCR area?
Good morning. Yes, we are. Yes, we are. You have already highlighted some important statistics and figures related to the air pollution related illnesses. And most of them are actually the case, they are true. And we are witnessing a rapid sudden surge in respiratory related illnesses in our OPDs, and I'm sure others must be doing the same. People who were previously controlled, doing okay with whatever medicine they had, suddenly are coming with increased symptoms, markedly increased symptoms, sometimes even landing up in emergencies and having to be given almost like critical emergency type care. The use of inhalers has to be increased, the dose has to be increased. So definitely we are witnessing a huge surge of respiratory related problems, not just in those who are already having respiratory illness, but even in those who are otherwise healthy.
You see, at the same point in time, experts, are contradicting with the kind of suggestions that they're giving out. People are saying, let your windows shut. At the same time, those who don't have the privilege of using an air purifier at home, they're suggesting maintain good ventilation. How does that happen, doctor? I mean, you're asking somebody to shut their windows, but at the same time, you maintain the right kind of ventilation.
Yeah, so actually, yeah, it's not easy. I mean, obviously, we need some fresh air, obviously, but the fresh air is not clean. So what to do? But yes, one does need some fresh air, and that is meaning, especially for the people who are having diseased people at home. For them, probably it would be better to be staying indoors rather than outdoors. Air purifiers, although not conclusively proven to help, have now been proven to help in some situations, especially with chronic respiratory disease. Those people who are at home and they use it, it might help to some extent. A couple of other things I think would be to use masks. I think they have to, when especially when they go outside and outdoor, they have to use the mask is very important. So it is fine balance between how much you open yourself to the atmosphere and how much you have to shut out. A little bit of balance, of course, you need some air inside.
No, you're absolutely right, doctor. Are there particular groups like the children, the elderly, pregnant women who are, let's say, more susceptible to the air pollution situation, the air crisis that we're seeing in Delhi NCR?
Yes, absolutely they are. And they obviously, the young children, their lungs are at the developing stage. Also, they have a tendency to play, and they consume oxygen at a much faster rate and greater quantities as an adult. So just see if they go outside and they breathe fast. So the amount of air they take in would be several times higher as compared to an adult, and that would be all toxic contaminated air. Naturally, they are going to get sick faster, and that is true. They get sick faster. Similarly, elderly people, they are immunocompromised. Their lungs obviously would not be working at the same level as for a healthy adult. So they are also compromised. So both the extreme of ages are at higher risk for respiratory related complications and even other disease complications for that matter related to a poor air quality.
You know what, doctor? We're flashing some of those precautions that have been put out by various health experts. Would you like to divulge some, special anecdotal, tip or technique that you yourself use in this current situation? And also, like dietary choices like antioxidants, vitamin C, do they really help?
See, regarding these dietary changes, they may help, but again, they are not short term. They are not short term solutions. Not just by popping a couple of pills during the couple of weeks at this time is going to make much of a difference. It is your overall body system how it helps you to battle against these and other illnesses. So it is a holistic nutrition and good diet as a whole, and not probably just a short term taking of some vitamins or antioxidants. That is, to my mind, the thing. As far as other things are concerned, at an individual level, a couple of tips is that instead of now all the people, hundreds, thousands of people, instead of taking the morning walks, it is better that they defer their morning walks for a couple of hours and go more in the midday, if possible, in the noon time when the bit of sun is out. In the morning, to very well, even I was out of the house at 7:30 in the morning. The AQI was around 600, 600 plus. So there is just no point in going out taking brisk morning walks at this point of time. And again, it is mostly the elderly people who do that. They are going to be much more at risk. So that is one thing that we need to change probably during this time period. Wear a mask whenever you go out. I think that's the best you can do. But I must say that this is an absolute emergency situation.